Hey everyone, welcome back to my channel Dental Cafe. So today we are going to discuss about the digital implant impression technique. This is part 4 for implant impression technique. Part 1, 2, 3 already discussed. I'll share the link. Now, begin with the digital impression technique. Now, what is digital impression technique? So in this technique, we are going to use an intraoral scanner to capture a digital scan of the implant and the surrounding tissue. So what is this digital scan? Look at the figure. The first we have a scan body. That is, we have a digital scan. We are going to place it over the implant, as you can see in the second figure, and then we are going to scan the nearby soft tissues and the implant with the help of scan body and scanner. Now the steps in the digital impression techniques. So after second stage surgery, we are going to remove the healing cap or the gingival former. As you can see in the figure, we are going to remove the gingival former or the healing cap before taking impression. Now we are going to air dry the implant and the adjacent teeth and the tissue before scanning the area. This is very important step. We are going to apply a scanning spray to the implant site and the adjacent teeth. Okay, now what is scanning spray? Scanning spray is to create uniform and non-reflective matte layer which allow for accurate and precise digital scanning by the scanners. So it prevents the reflection and it provide a matte layer so that we can easily scan that area. After applying spray, now we are going to place a scan body over the implant. As you can see in the figure, we have a scan body and we are going to place the scan body over the implant after removing the gingival former. Now we are going to use an intraoral scanner to scan the scan body of the implant and the surrounding tissue and the teeth. Now we are going to wash, dry and spray and scan the opposite dentition too. And then we are going to remove the scan body, again wash, dry and ensure that the patient is in full occlusal contact so that we can record the patient occlusion. So this is a digital impression of one of my case. As you can see, after gathering all the data, this is a digital impression of the maxilla, this is digital impression of the mandible, and this is in occlusion. So we have to scan the jaw, in which we have to plan to give a prosthesis, then the opposite arch, and then the joint occlusion. Now the last part, prosthesis designing and the fabrication, and this is also one of my case of implant. In this hybrid denture prosthesis is designed. As you can see, with the help of CAD software, we are going to design the prosthesis and fabricate the restoration. With the designing software, we are going to design the prosthesis virtually, and then with the milling software, we are going to mill the prosthesis. And this is, we have a final prosthesis or a hybrid denture, and this is one of my case of full mouth, and this is a hybrid denture case, and the framework in this denture is fabricated by scanning. And this is the entire procedure in short. As you can see, first we are going to remove a healing cap, then we are going to apply a spray, then we are going to attach a scan body, then scan both the arch and the arch in the occlusion, and then we have a digital impression. Over this digital impression, we are going to virtually fabricate the prosthesis, and then we are, with the help of software, we are going to mill the prosthesis, and this is, we have a final prosthesis. Now the advantages. First of all, it will reduce the chair time. Why chair time? Because you don't need any conventional method of taking impression with the impression material. It is very time consuming and a very messed up procedure. Improve patient comfort, as it eliminates the need for messy impression materials and the tray. And enhance accuracy. Yes, digital impression is more accurate as it is not manually taken, it is scanned by the scanner, so it provides better fitting. Reduce the risk of errors, as it is more accurate and no impression material is required to take a impression. We are using scanner and the scan body, so chances of error is very less, and reduce need for impression material, as I told you. So I hope this video is helpful for you to understand about the implant impression technique. If you want clinical video related to a digital impression technique, I'll definitely share the video do comment on comment section, and don't forget to like, share and subscribe my YouTube channel and hit the bell icon for the latest update.